Good afternoon, everyone. I am Keshav Singh representing Pair Academy. I hope you all are doing well. On behalf of Dakshayani and Amravati Health Education and Patient Academy for Innovation and Research, I would like to welcome you all to today's webinar on learning from diagnostic errors. Thank you for joining us. As you would know, every year on the 17th of September, the World Health Organization commemorate World Patient Safety Day, highlighting the different themes annually. And there are several activities all around the world happening from the date of announcement. This year, the theme is improving diagnostics for patient safety. And the Pair Academy, along with the Patient for Patient Safety Network Asia Pacific and Dakshama Health, have planned a series of 6 webinars around this theme. So this is the fourth webinar of the series, which is learning from diagnostic errors. Diagnostic errors compress a broad scope of concern as approximately 70% of clinical decisions are informed by laboratory results. Gaining perspective from laboratories, nursing specialists, and patient organization can offer a new insight into ensuring quality standards and accreditation. This webinar will hopefully serve as a platform to dive into the complexities of diagnostic safety, uncovering the strategies to improve patient outcomes and then enhancing the overall quality of care. By working together and listening to everyone's idea, we can ensure patient receive the right diagnosis and stay safe during their diagnostic procedures. So I would like to invite Dr. Ratna to have some words. So can we have slide, please? Dr. Ratna is a medical graduate with the master's in business administration and has a deep passion of health system strengthening and especially with the patient correlation and co-production. Dr. Ratna is CEO of Dakshama Health and Director of Patient Academy for Innovation and Research. Over to you, ma'am. Thank you so much.
Thank you, Keshav, for that kind introduction, and welcome everyone to this fourth webinar in the series. And it's my pleasure to be part of this journey with so many other professionals who have been kind enough to engage with us as speakers and contributors. And we know that patient safety is extremely important, especially in the context of low and middle income countries or developing countries like India and the region, specifically Asia Pacific, because many of our health systems are not very strong. We do not have systems in place, and patients sometimes have to move from one system into another, and therefore ensuring standards for diagnosis as well as for outcomes is very difficult. In such a scenario, getting the patients to learn what they should be aware of, able to ask the right questions to their healthcare providers, ensures that the margin of is lesser and therefore they are more safe. So it is this theme and background ahead with a webinar that will culminate in the celebration of the World Patient Safety Day of 17. And every year we, with the theme that WHO sets for the year's theme is to work with patients to ensure diagnostic safety. We decided that we are medication safety, blood safety, surgical safety, and knee break injuries, etc. But diagnostic safety has been picked up as an extremely important factor since, as Keshav gave in his introduction, 80% of physician decisions are based on lab results or results from the blood workouts, etc. And if those are not correct, then the physician cannot make a right decision. And a lot of diagnostic errors happen because what is coming from the lab is not the correct result. And what is coming from the lab depends on a lot of things. It's the right patient, right sample, right procedure, and right analysis. So to listen from the experts today around how do we ensure that everything is right, we have 3 speakers, and I will hand back to Keshav to introduce the speakers to us. And thank you once again for joining us.
Thank you so much, ma'am. Thank you for kind words. Can we have slide, please? Yeah. So, I'm pleased to introduce our esteemed panels of speakers who will share their insight and expertise on the critical topics. And first of all, we would like to invite Dr. Bhaskar Bhattacharya. Dr. Bhaskar Bhattacharya is a distinguished medical professional with extensive expertise in biochemistry. He is currently served as laboratory director at Ganu Path Lab Limited in Kolkata, India. Dr. Bhattacharya has held MBBS and MD in biochemistry, having received his training to renowned institute including NIMHANS Bangalore. We welcome you here, sir. Can we have next slide, please? Dr. Asuma Bevi. She is, Dean and President at Nursing Research Society of India. She has done his basic graduation from Government College of Nursing, Thiruvananthapuram, Kerala, and then post graduation from Christian Medical College. And then she has diploma in medical education, hospital management, computer application management training, HIV/AIDS, TB from Indian Nursing Council. Then she has 68 publication in various journal. So ma'am is not able to join us today, so we have a recording from ma'am. So can we have next slide, please? So then we have Arijit. Arijit is an assistant secretary general of Heart to Heart Foundation in Thailand. Arijit brings with 42 years of experience in policy and plan analysis and community plan development. She has served as a Thailand Society Investment Fund in the World Bank. Then and she has a bachelor in economics, then masters of science in human settlement planning and development. So we would like to welcome you here, Arijit. Thank you so much for joining us. Thank you, panel, for joining us. So I would like to invite Dr. Bhattacharya to deliver his lecture. Can we have slide, please?
And Dr. Bhattacharya, you may use about 20 to 25 minutes because we have some time with us. So please feel relaxed,
Fine.
and because your
Thank
topic
you.
is so important, it is important that people understand what you're speaking. So please feel free to.
Thank you. Very good afternoon. Can you hear me?
Yes, sir. It's perfect.
Okay. The first, I must thank Dakshayani and Amravati Health Education to give me this opportunity to speak on this very relevant and very significant topic, and the role of lab technicians in preventing diagnostic errors. So the core terms, the lab technicians and diagnostic errors, which are very friendly uh, as far as the diagnostic arena is concerned. Entire diagnostic team cannot function without single entity. So in my next slide, I will just explain the roles of the who is that lab technician. The laboratory technician is a professional who is involved in every aspect of laboratory work, starting from recording data to maintaining equipment and generating reports. They are responsible for various tasks that follow strict guidelines and regulations, including protecting the accuracy and efficiency of experiments while keeping labs organized. It is their collective responsibility. And what are the skills which we look for the laboratory technicians, which includes the technical skills, attention to detail, analytical skills, and the communication skills and problem solving skills. That is a very important. It is not just they will come and charge the sample to a equipment and get the result. They have to go through uh, series of information and assessment during the conduction of this activity. Is a laboratory activity is a very complex activity. As you know, it is the live samples which they deal with. It is the live samples. It is not just an autopsy sample. With the live samples, they have to be very cautious what they are doing with their technical knowledge and the experience, and also the certain skills which I have discussed here. In the next slide, the role of technicians, if we go a little deeper, so I will explain one by one. The responsibilities of these lab technicians in diagnostic process from sample collection to analysis and reporting. The lab technicians now, which we consider starting from the sample collection only. This sample collection is a very critical and not an easy job. They will puncture the vein in a perfect process as per the SOP, and they will draw the blood. They will extract the blood if it is from the blood test, and if it is from the urine, they have to properly collect the sample in a proper container, in a proper way, in a proper preparation. They will collect. So the entire program starts from there. And to the reporting, 1 second, sir. তো ওয়েট করতে হবে 0.5 ঘন্টা, হ্যাঁ, কিছু করার নেই, কিছু করার নেই, 0.5 ঘন্টা ওয়েট করতে হবে। ডেট 200 নিতে হবে পরে, আগে পরে। So they are involved in receiving, labeling, analyzing samples from blood and then tissue and the toxics like certain drug elements. Also, they have to take that, and they are involved in designing and executing laboratory testing according to the standard operating procedures. They are also involved in the conducting experiments under defined conditions to verify or reject various types of hypotheses which are using refined scientific methods and the current scientific methods. They must be aware of what they are doing and at the same time conducting the test. The importance of lab technicians in ensuring the reliability and accuracy of diagnostic tests. The medical lab technicians play a very, very important and vital role in ensuring the accuracy and precision of the results by following stringent procedures and the protocols. Inaccurate results can lead to incorrect diagnosis, delayed treatment, and even patient harm. So coming to next slide. What are the common diagnostic errors which we normally counter? So these pre-analytical errors are now, the more specific term is pre-examination errors and analytical errors or the examination errors during the time of assessment or assessing a sample. What are the different types of errors that can be encountered, and the post-analytical errors. In the pre-analytical errors, which involve inappropriate test ordered, that is the first, inappropriate test ordered. Next is the patient misidentification. Next, mislabeling or absence of labeling of the specimen container, inappropriate container for specimen collection, insufficient volume of specimen, inappropriate storage, handling, or transport of specimen to lab. These all includes, these are the common and usually encountered errors. In the analytical error, we have got this equipment failure, including calibration errors and undetected quality control failure and interference with assay. Like certain tests which are required for fasting status, and patient is having full stomach, and then it will interfere. These assessments are encountered during the analytical error. In the post-analytical error, most important is the incorrect clinical interpretation or response to laboratory result. It is very important because nowadays patients or the individuals who come for general tests or doctor referred tests, they are aware of what they see in the paper, because lab's ultimate product is the paper, which paper or in the soft copy, which are scripted information of their health condition. So in that they should be very, very careful of interpreting the result. In most of the cases, the clinicians or the associated laboratory consultants, they can take care of that interpretation part. But at the same time, there are some protocols which maintain which are maintained by the technicians, that in response to a particular uh, result value, they will put some standard note or interpretation, which also the ISO 15189, that is this is the ISO guidelines for the maintaining the competence of the lab. There also it is explained that in clinical interpretation is very very important, because patient should be aware what the result is telling to him or her. Then excessive turnaround time or failure in reporting. Now turnaround time is a very critical uh, point, which is very very important for a correct diagnosis in correct time. If the diagnosis is correct but it is delivered late, then it makes a problem. It causes patients harm in many ways. So these are the common diagnostic errors. Each and every portion, there is an involvement of the team of this laboratory work. Next slide. Yes, this is a different uh, types of errors which are possible from laboratory different examination process. In my tenure from 2002 2002, I have carried out certain works on these laboratory errors, and I have found these are the commonest, and there may be some common items in the different phases, but these are the things which are total in number 112 points which we have seen. Each I have tried to discuss in detail what are the possible things, and say in the during the time of ordering a test, if the order has been taken but the patient's preparation is not proper, patient's preparation is not proper, then it comes to a different, then it generates an error in the reported result. So these things are very, very important. And if the slides are shared, then everyone can go through it. It's a detailed information on the various examination steps. Even there is a concept which has been come now. That is the pre-examination step, which is the patient preparation, and the post examination step, which comes to delivery of the report. If the report is prepared, report has been approved, report has been um, it has been ready to release. It has been released, but till it reaches the appropriate end user of that report, and with that report, they have to the clinicians or the doctors, they have to take immediate action in some critical cases. So there it comes the completion. So there it impacts the post examination step. So these are the various possible sources of identified errors in different examination processes. Next slide. So this is a cyclic propagation of error generating behavior, which are usually seen in if it specific and proper care is not taken, like retrospective analysis of critical incident, the critical incident classification, the remedial actions proposed, then introduction of newer complexities in the process, and increased opportunities for errors. So this cycle goes on when during the time of critical incident classification, this mechanical error, the human error, the systematic error, those all impact, and we should immediately go for this remedial action without any delay. So the procedural revision is required if necessary. Administrative sanctions are required, and the legal action has to be taken to prevent the error for the next time. And introduction of new technology when the old technology is getting the hindrance for a proper result of the test. Next slide. And now coming to the how to prevent these diagnostic errors. Most important and foremost is the training and education in the system. This technical knowledge, technical know-how of a scientific methodology has to be incorporated in uh, the concept of the technician. So there lies the responsibility of the responsible trainers who has to train them properly. And in most of the cases, it has been seen that there due to certain in certain countries of the economical issues, and also the sustaining certain types of uh, problems and something like that, that if the courses are not being conducted in a regular basis or some hindrances might be there, so they have to be always in a continuous process of training and education of what they are doing. And this importance of continuous professional development for lab technicians is to keep up with the advancements and the best practices in the field. Sorry. So in that case, it is always important to get them trained, if necessary retrained, so that ultimate goal is to make them aware what they are doing and for the betterment of the patient's health. Next is the, I'm sorry, next important is the standard operating procedures. Whatever type of test they are doing, they should be aware that it should be appropriate as updated they are doing. So this will definitely minimize the error. And here comes the role of this NABL, which is the National Accreditation, this a board of clinical laboratories, which is under the Quality Council of India. In our country, it is practiced in that way that accreditation is awarded to the laboratories who opt for that, though it is not mandatory yet in your country, India. But in many places, it is a mandatory to have the accreditation. So that accreditation plays a very important role, where correct result in correct time is the ultimate motto of the entire program of laboratory activity. So they are as per the program, as per the it is the ISO 151 guideline. Now the latest guideline has also come 2022. So there it is nicely explained about the role of these recommended and guidelines which that each and every lab should practice to have the best output as far as the patient's health and medical aspects are concerned. Now, in the preventive diagnostic errors, these quality control measures also is a very critical activity. Before doing any test, the lab should be, the technicians who are performing the test, they should be fully aware that there should be a very strong internal quality control and also external quality assurance to different organizations. Internal quality control will be definitely the highest priority because it is the way how you can assess your own lab first. That is the best thing. And how precision, when you maintaining the precision, you can deliver the result. That is the prerequisites of any lab who is going for getting the test done for patients. The next from the external quality, which is assuring that my lab or the lab's results are at par with the other labs using the same equipment. It might vary, right? Adjustable, acceptable variations, because there are very many numerous instruments are there, numerous methodologies are there, but we should always try to have the best methodology and the updated processes in equipment. So that also includes the regular equipment maintenance. It is the most important, and the proficiency testing and participation in external quality assessment programs. These are the basic things which, if we take care very specifically, and this is the role of the technicians who are the ground level, the base level members of the entire laboratory team, if they are concerned, and most of the places this is already in practice, so that definitely prevents the diagnostic errors. Next, this is the quality assurance in pre-analytical phase, just a schematic diagram type. In the internal quality control, which are the laboratory quality indicators as per the 9001 or 15189, and we detect the deviations and we immediately do the corrective actions. In case of external quality evaluation programs, we see the inter-laboratory comparisons, how and we take care of the evaluation program, and then we see the how lab is performing with the options for improvement. These are the different types of quality excuse me, quality assurance programs where we can go through that. Next slide. This is the most important use of technology. Technicians team, they are always inquisitive to know that what they should be always inquisitive to know the what best methodology they are adopting to deliver the to deliver the results. And these advanced technologies with the use of automated equipment, automated systems, and the laboratory information management system helps a lot to reduce human errors and enhancing accuracy. In most of the places, this technology usage is also supported very comfortable way by the management team. They are also aware that best technology in the competitive market, best technology with the best possible with minimal human intervention. Human brain is required, but intervention to reduce error as far as possible, it is best. So, by the way, we know that technology has already touched upon everything, and diagnostic is no exception in that. Next comes to the effective communication. Clear communication among lab technicians, clinicians, and other healthcare professionals are very, very important to ensure accurate interpretation and use of diagnostic results. Lab technicians must be able to explain the technical information in a way that is easy for others to understand. Secondly, they must be able to listen carefully to instructions from the supervisors and the feedback from their colleagues. This is a clue to best effective communication, which will ultimately result in the best output of the intended work, and, and thereby minimizing errors. Next, now coming to the values of laboratory. What are the different types of values uh, which are very, very important for as far as the laboratory is concerned, and where the core role is by the laboratory technician. Reliable laboratory workflow and faster TAT on request of all lab tests, professional patient treatment through extended laboratory services like going beyond hours to help the patient to have the best output from the laboratory services. Then cost reduction for processes, accurate scientific validation and support, and quality result which are issued from the lab. Next. So in conclusion, preventive laboratory error and improving safety. The role of laboratory trained healthcare professionals, the laboratory technicians are very, very important. They play the most important role in the entire laboratory team. Laboratory errors are not isolated or unpredictable entities, but reflect the constituents of the entire healthcare system. Laboratory technicians contribute a lot to the pre-analytical phase of the laboratory practice and have an important role in preventive pre-analytic laboratory errors, which contributes to almost around 68 to 72% of the entire laboratory errors. And coincidentally, or in a complementary way, as per the current trends, at least 70% of the treatment modalities are dependent on diagnostic labs. That's why it's very, very important to put the laboratory errors in the minimal way so that patients get maximum benefit with the results that are processed in the lab services. The routine review of the laboratory errors and non-conforming events and their fast detection by the lab technicians serve as opportunities to improve patient safety. So thank you very much. Any questions are it will be encouraged a lot.
Thank you, sir. A couple of quick questions before we move to Aurojit for her presentation. One, and this is a curious question. I don't know whether it affects the quality, but considering that we are experiencing very high temperatures right now. Similarly, in winters we have very low temperatures. So, do climatic conditions affect sample quality? And if that is true, then what can patients do, especially when there are home collection centers these days? A patient that doesn't necessarily travel to a lab to give a sample. So, what should the patient be aware of under such climatic conditions?
The most important thing is that, see, when a patient is going for a laboratory test by his or her own will for getting the preventive testing or the health packages, they should always get it done. The lab should come and get the sample extracted as early as possible, not to delay the system. And it should be assured by the lab member who is collecting the sample that it should reach lab as fast as possible, because any delay will impact the integrity of the sample. That is most important. And second point is that it is the duty of the patient also, or the individual, to see that his or her blood sample or urine sample is reaching the lab in proper time. That is most important. Just by giving the sample to the sample collection representative and after in the evening hours collecting the sample, it is a collective responsibility of him also or her also to see whether it is transported properly or not, because any error generated which is impacting the quality of the impacting the integrity of the sample, it will reflect in the result. It is not protected or it is not immune. But nowadays many of the labs, they go for this very strict protocol they maintain while transporting the sample in a best possible manner with a controlled condition. That is the most important. Patients should be aware that they should see that it is happening or not. That will impact a lot. That will.
Thank you. And in your slide where you were showing the analysis, you have written forgotten in many places. What exactly does that forgotten mean?
Forgotten means because see, number of patients are much more as compared to the
Okay.
number of technical staff who
Technicians.
is collecting the blood. The
Okay.
blood collectors are also technicians. They are not
Yes.
from some other way. So sometimes it might be missed. So that's why it is very important. They should be fully aware that they should not forget. Patients or the individual from the same home, they should also put some effort to be properly processed or not. The awareness is the most important thing, which we are collectively doing this.
Got it, sir. So thank you so much. And we can now move on to Aurojit for her presentation.
Okay, thank you. Can I have my slide, please? Good afternoon, everyone. Okay, thank you for allowing me to speak about the patient story of Thailand. What can patient organization do to enhance diagnostic safety through patient story? So this is about Thailand case. Next slide, please. Maybe I can go faster. Thailand, we have 67 million population. Very, very small compared to India population. Okay, next slide, please. As you know that the WHO has already done the Global Patient Safety Action Plan 2021 to 2030. Next slide, please. And then Number 4, next slide. Next slide, please. Number 4 for the strategic objective 4, talking about patient and family engagement. It's already there. I'll not go in detail. Next slide, please. What I like to talk about here is the universal health coverage of Thailand. The policy objective is to improve health for all Thai people by providing equal access to quality of care in accordance with health needs of population on equitable basis, and to prevent Thai households from being in catastrophic situations when facing with high cost care. So next slide, please. And in the universal health coverage system has emphasized the importance of protecting the rights to participate of the people, patient, and all partners. If they have active participation, will allow their voice to be heard and transformed into policy and implementation. And this is already proof and ongoing in the system. And the strong partnership between our partner can already provide the policy and implementation decision in the right way according to the patient needs. Next slide, please. And in the National Health Security Act, it's already including people, patient participate in all level of the system. The people and patient organization can sit in the board. In national level, it fight in the national level and also fight in quality standard control board. And in regional level also, we have 13 regions nationwide, and the provincial level, they have provincial quality and standard control subcommittee and the compensation subcommittee. This I will explain later. And in the local level, they have community health fund committee, which the patient and people can sit as a committee member. In the right-hand side, you can see that there are community independent complaint center according to the Act Section 50, parenthesis 5. This I will talk later. It's concerned with the case study. Next, please. And it's the picture about people patient network in the system. I will talk mainly in the community independent complaint center network, which right now there are 144 centers all over country, and also patient support center that they work closely with the hospital and the healthcare unit in the community as well. They are patient organization, mainly in the NCD patient and high cost care patient. Next, please. You can see the activity that the patient they involved, and this is the on the right hand side. You can see one center in the northeast of Thailand. They are quite very active. Next, please. And next one picture is not come yet. For the high cost chronic patient, you can place one more. I think the picture will come. Talking about those high cost patients, they are in a group and network, and they work together to have their voice stronger and to be heard. Next, please. Yeah, this is the renal, the kidney patient group. They go to the government house to fight for the benefit package in the health security system. Next, please. And it's already there. And this is all those patient group that they are working. Next, please. Next, please. Yeah. And the voice of people patient in the universal health coverage can be heard through several channels. And today, I will talk on the number 3 and number 4 channel. It's about Community Independent Complaint Center according to section number 50, parenthesis 5, and the preliminary assistance for patient and service providers, or we call no fault compensation, no proof of right or wrong, according to section 41. Next, please. And also in the universal health coverage, we have also talking about consumer protection in several sections. I'm not going in the detail. Next, please. And this is the framework of the complaints center, complaint channel. Patient, if they have problem from the service, they can go to National Health Security Office, the main office, or they can call hotline 1330, or they can go to the regional office, the National Health Security regional office in 13 office, including Bangkok, and go to the provincial health office in every province, 76 province, not include Bangkok. Hotline now they are 200 line 1330. You can call 24 hours, and also can go to the Community Dependent Complaint Center. Right now there are 144 units that already registered with the National Health Security Office, and they work closely on the left-hand side with the center in the hospital. This is belong to the center, belong to the hospital. Next, please. Now, talking about Community Independent Complaint Center, the Universal Health Coverage Act, number 50, parenthesis 5, it stimulates that a complaint unit that is independent from the accused be established as a center to protect rights. As I told you, now is 144 center in 77 provinces, operated by civil society and patient organization, have to disseminate information and knowledge to foster the people understanding of their rights and the channel for accessing those rights independently in order to receive compensation from healthcare service problem. And the Quality and Standard Control Board declared the criteria for registration of Independent Complaint Center on 19 February 2009 and developed training curricula to train the center staffs. Next, please. Every center has to be trained. The implementation process is when the patient and their family have problem from the service, they go to the center. This center, they will receive cases, and they explain and foster understanding according to the system, and also talking about fact-finding. Then they submit case to the Provincial Compensation Subcommittee. These the people and civil society, they also sit in this subcommittee, and after that, the subcommittee can have decision. They can go to the compensation to the patient and family. If not, they go to the Quality and Control Subcommittee in the central office here, and then they will provide assistance or provide compensation, and that is the final decision. Next, please. This is in detail. There are center both in from the local government right now. The local government also have center, and the community group, and also in the civil society. Next, please. For the preliminary assistance, this also in the National Health Security Act. I would like to mention, because it's especially already in the act, we call no fault compensation. According to Section 41 required that the National Health Security Committee earmark no more than 1% of the fund. Every year is about 200 or 300 million baht in the fund for preliminary monetary assistance to service recipients who have the problem from service. And this is managed by as the no-fault compensation fund, the fund that I mentioned. The patient has only to prove that there have been negative implications from receiving health service from the committee that they have made decision, and there is no need to prove who is wrong. The Quality and Standard Control Board will make the final decision in providing the no-fault compensation within the determined rate, because it's already as a regulation that in what rate they can have, and refusing the appeal. Next, please. This they can come to negotiation. And I'll not go into detail. This one is a patient support center. They work closely with the hospital in order to have a good understanding and collaboration so that it will reduce or lessen the cases of the problem from the service, and lesser the work of the complaint center as well. Next, please. And this is what they are doing in the hospital, and also advocacy work. Next, please. So come to the case. This we call Nakhon Ratchasima model. Nakhon Ratchasima is quite a big province in the northeast of Thailand. Maybe you heard about that before. Nakhon Ratchasima model is a model of a cooperative network to resolve complaints and protect national health security insurance system. I will not talk much in detail, just tell you that the story starts from Sompong Sammo. He is a middle-aged man, went to the Bua Yai hospital. Bua Yai is a provincial, it's a district hospital, but quite a big hospital. Bua Yai hospital, he went with his wife to undergo medical examination, and he has a fever by the time, and both feet were abnormally swollen, and he thought that maybe because by stepping on a nail about 2 weeks ago, but did not tell the officer about his incident by the time he went to the hospital. So as a result, the diagnosis was determined to be a possible embolism, and he was referred to another specialist instead. This is a problem. The moment when waiting to see a specialist doctor, it was seen that Sompong was unconscious and sat still in a wheelchair for more than 30 minutes at the waiting point, and a sign that he at least of death. Therefore, someone informed the nursing staff before the emergency department was rushed to help him, but then he was not in time and Sompong was dead. Next, please. And after that, people in the community took the story to demand justice to the media after understanding that Bua Yai Hospital was dismissed the blame, and they would like the family to sue the hospital for a large amount of money to take responsibility for what happened. And the next morning, the nursing team and the management of Bua Yai Hospital went to the patient family to express their condolence and provide an initial assistance of 10,000 Thai baht. But this is not according to the preliminary complaints system, just from the hospital. And meanwhile, the chairman of the Bua Yai Patient Protection Center, Pachalapon, also visit the patient family to follow up and explain about the preliminary assistance section 41 that they can receive the compensation under the National Health Insurance System, or we call Gold Card. Next, please. And the section 41 I already mentioned. From Pachalapon, the chairman of Boyai Patient Protection Center, she introduced herself and the role of the center, and to make them understand more that they are network of people who come to protect the rights of health insurer according to the law, and they have no interest in what happened. Next, please. You can see they are talking and discussing. And after meeting and explaining to understand the family of the victim of this time, make them slimming emotion of the community, lower the temperature, and it's good. And she said it's good thing that day to have many people from the village and the community and the staff from the hospital and the healthcare were there. And also she went to talk with the president of Semayai Sub-District Administration Organization, that is local government, so that all parties have a more consistent understanding. And later, Buayai Patient Protection Center, and Buayai Hospital, Nakhon Ratchasima Province Public Health Office, and the National Health Security Office District 9 in Nakhon Ratchasima follow up the case. Next, please. Next. And the police department also expedite the process for the victim to receive the remedy as soon as possible, because they are afraid that they should not wait. Otherwise, the victim will suspicious of the work of various agencies responsible. And after that, through the incident, get to the incident well, our public health agency and network, such as the Nakhon Ratchasima Province Health Department, and also Buayai Hospital, and some other people, including the Buayai Patient Protection Center, agree that there should be a joint integration in the development of the service system so that this kind of incidents does not happen again. This incident of a man stepping on a nail to death in a wheelchair in Buayai Hospital in 2021, it was considered a challenging deadline dealing with the problem of complaints and an important turning point that made various public health agencies in Nakhon Ratchasima Province cooperate to prevent the recurrence of the incident, leading to the Nakhon Ratchasima model. Next, please, the last one. And later, the municipality, Buayai municipality, also come to participate, and they are more active and set up a Buayai Municipal Health Insurance Coordinating Center. It was held in September 2022. To communicate and educate the community about the benefits and rights of patients. That is, make the people more understanding. And currently, it has been almost 3 years in the Nakhon Ratchasima model. However, this is not a bad thing, because it is the direction of the service system that will be carried out, as well as a reflection that the public is more aware of their right, as well as the service units have consistently developed and closed the gap in the system. Okay, last slide, please. For the further action plan of patient organization and network, we have to empower the effective community in independent complaint center and patient support center with good and wider collaboration with stakeholders, and develop Thailand Patient Safety Action Plan and collaborate with regional and global action plan, as I understand that Dr. Rana is developing for Asia Pacific Action Plan as well at the moment. And the patient organization have to actively participate in the patient safety working group of the Healthcare Accreditation Institute and proposed their patient safety action plan to the working group. Fortunately, a few days ago, I have a chance to meet the director of the HAI, and I told her about the patient safety action plan that we going to develop and propose to the working group, and in order for her to consider and include in the national patient safety action plan. And she agreed, and she said sorry to Ratna that time that she can't be a speaker because she is very, very busy by that time for the event of the HSI event, HA event that is almost 500 hospital or 1,000 hospital join the event. So she's very busy and she says sorry. So I said next time, next time. Okay, thank you for your for your attention.
Thank you, Rajit. I do have a couple of questions, but I'll come back to you after we have played the recording for the third speaker.
Okay, no problem.
Vikas, can we have the recording, please?
Hello, good afternoon. At the outset, I would like to thank Patient Academy for Innovation and Research for inviting me to talk to you on nursing and diagnostic errors, impacts and solutions. I am Asuma Bibi, Dean, Astromims Academy, and presently the President of NRSI. Let us start with the topic. As an introduction, it is better always to discuss what is diagnostic error first. So diagnostic errors are mistakes or failures in diagnostic process that lead to a delayed, incorrect or misdiagnosis. These errors can occur at any point of the diagnostic process and can have significant implications for patient safety and outcomes. Nursing plays a crucial role in the diagnostic process. Nurses are often first point of contact for patients, gathering vital information about their symptoms, medical history, and current condition. Nurses collaborate with other healthcare professionals such as physicians, specialists, and technicians to ensure accurate diagnosis and appropriate treatment. Let us see what are the components of diagnostic errors. The first one I would like to discuss is delayed diagnosis. Diagnosis is eventually correct, but not made in a timely manner. Delay in treatment can lead to disease progression and worsened patient outcome. So delayed diagnosis lead to disease progression and worsened patient outcomes. Then second one is incorrect diagnosis. Here the patient receives a diagnosis that is incorrect, can result in inappropriate treatment, potential harm and lack of treatment for the actual condition. Then missed diagnosis. Here the condition is not diagnosed at all. The patient does not receive necessary treatment, leading to potentially severe health consequences. Then what are the causes of diagnostic errors? The first one is the cognitive factors. It has three areas. The first one is premature closure. This is concluding the diagnosis too early without considering other possibilities. Then second one is anchoring bias, that is relying too heavily on the initial piece of information and failing to adjust. The third one is confirmation bias, seeking information that supports an initial hypothesis and ignoring the contradictory evidences. These are the causes. So there are three areas in the causes of diagnostic errors. The first one is cognitive factors. In that, premature closure. Second one is anchoring bias. Third one is confirmation bias. Then second cause is systemic factors. Here comes communication failures, miscommunications among healthcare providers or between providers and patients. Then inadequate follow-up is another systemic factor. Failure to track or follow up on test results or referrals. Then third one in systemic factors is workflow issues, inefficient process and systems within the healthcare setting that hinder proper diagnosis. Then what are the impact of diagnostic errors? The first one is patient safety. Diagnostic errors can lead to incorrect or delayed treatment, potentially causing harm or even death. This may increase the morbidity and mortality. Then quality of care. It affects, impact of diagnostic error is that it affects the quality of care provided. They undermine the quality of care provided to patients, leading to loss of trust in the healthcare system. And this is due to delay in treatment or incorrect treatment. Then healthcare cost, another important factor. That is, incorrect or delayed diagnosis can result in increased healthcare costs due to unnecessary tests, treatments, or prolonged hospital stays. So, healthcare cost of the patient increases when diagnostic errors occurs. The next is legal and ethical issues. Patient may go for a malpractice claim because of the loss of trust in healthcare providers when there is a diagnostic error. So to put it in a nutshell, it affects the patient safety, it affects the quality of care, it increases the healthcare cost, and legal and ethical issues will develop. That means patient may go for malpractice claims. Then common diagnostic errors involving nursing. When we think about nursing, we need to specifically think what is the role of the nurses in diagnostic errors. Here, the first point I wanted to tell you is failure to recognize symptoms, missing early signs of deterioration, and we may not be reporting it properly. Then miscommunications, inaccurate or incomplete information on handover to the next person or reporting. Then incorrect data entry, errors in entering patient information or test results. This is a common feature of diagnostic errors involving nurses. Inadequate follow-ups, failing to follow up on test results or referrals. Sometimes nurses forget about the tests performed and they may not be contacting the laboratory services to get the results in time. So what happens is inadequate follow-up resulting in delayed treatment for the patient. Then bias and assumptions. Cognitive bias leading to incorrect assumptions about patient conditions. This is also a common problem with the nurses. I would like to talk to you about a case study, diagnostic error due to miscommunication. Case description: a 55-year-old male patient presented to the emergency room with chest pain. The attending physician ordered an ECG and blood test, but did not communicate clearly the urgency of this test to the lab staff. The physician ordered for ECG and also for blood test, but the urgency of the situation is not communicated to the lab staff. So they might have taken the blood, they might have taken the ECG, but may not have been reported properly. So as a result, lab results indicating heart attack were delayed and the patient was initially misdiagnosed with acid reflux, that is GER, gastroesophageal reflux. The correct diagnosis was made several hours later, leading to significant heart damage due to the delay in appropriate treatment. Impact on patient outcome in this case scenario, the delay in diagnosis resulted in increased morbidity for the patient, including permanent heart damage. The patient experienced significant anxiety and a loss of trust in healthcare providers, and the extended hospital stay and additional treatment required lead to higher medical costs. What are the lessons from this case scenario? This case underscores the critical importance of clear and effective communication within the healthcare system. Ensuring that all team members understand the urgency of orders and test results is vital. Implementing standardized protocols and checks for handling critical tests, promoting interdisciplinary collaboration, and providing continuous education on effective communication and teamwork can help prevent similar diagnostic errors in future. So we have to find out what are the root causes in this case. The first one is cognitive errors. The physician exhibited anchoring bias by focusing on the patient's history of heartburn and prematurely closing the diagnostic process without considering other potential causes of chest pain. Then second, systemic issues. There was a failure to promptly review and accurately interpret the initial ECG results, and inadequate follow-up on diagnostic tests contribute to the misdiagnosis. Then communication failures. There was a significant communication between patient. There was a insufficient communication between the patient and the physician regarding the severity and nature of symptoms. What are the lessons learned? Thorough assessment is a must. A comprehensive assessment of chest pain should have always considered cardiac causes, and even if the patient has a history of gastrointestinal issues. Then prompt review of diagnostic tests. The immediate and accurate interpretation of diagnostic tests like ECG is crucial in emergency setting, especially when a patient presents with chest pain. Then effective communication. Clear communication between healthcare providers and the patient is essential to ensure all potential diagnoses are considered and addressed. This case highlights how diagnostic errors can have serious implications for patient safety. By recognizing the potential for cognitive biases, improving diagnostic process, and ensuring effective communication, nurses and other healthcare providers can reduce the risk of such errors and improve patient outcomes. Then solutions to reduce diagnostic errors. The first and foremost one is enhanced communication. This can be done through a structured handover process. SBIR, we call it as situation, background, assessment, recommendation technique. So when you are giving a structured handover process, we have to explain what is the situation, what is the background, what assessment was done, what was the recommendation. So communication should go as a structured handover process with the SBIR. Then education and training, ongoing training programs on diagnostic accuracy and simulation training with case scenarios are also important. Then use of technology, electronic health records, decision support system, etc. will help in reducing diagnostic errors. Then checklists and protocols, standardized checklists for common conditions and diagnostic protocols will help to reduce diagnostic errors. Then team collaboration, interdisciplinary team meetings, joint decision making, etc. are important to reduce diagnostic errors. Then role of nurse nurses in improving diagnostic accuracy. The nurse being the first-hand information provider and also most of the time 24-hour 7 into 24 hours. That means every time the nurse is with the patient. So nurses should show their vigilance in uh, diagnostic accuracy. So what we can do is vigilance and observation. Keen observation skills. Early recognition of changes in patient status is very important. If a patient comes with chest pain, the nurse has to identify what type of chest pain, whether the chest pain is radiating, to which part of the body it is radiating, whether it goes to the shoulder. Like this, the the nurse should be able to find out and should have keen observation of patient's condition. Then patient advocacy, ensuring patients' concerns are heard and addressed properly. Then continuous learning, staying updated with the latest diagnostic guidelines and best practices is very important. Collaboration with lab technicians or lab people, ensuring clear communication and understanding of lab results. Here, collaboration with lab technician, when we say ensuring clear communication and understanding lab results, once we are sending some specimen to lab, we should see that it is properly labeled, it must be communicated properly, and we should follow up it to find out what is the results, and it must be communicated to the physician concerned. Then implementing a culture of safety. We talk too much about patient safety. We should see that we are ensuring a culture of safety in all our practice in the hospital settings. Non-punitive reporting system should be there. If somebody is doing a mistake, we are human. Error is everywhere. That means human beings can make errors, but we should be able to openly accept it and report it if something happens. That will help us to revert the error and save the patient. So non-punitive reporting system should be established in any working situations where nurses are working, especially whether it is a clinic or a OPD, if it is in the wards like inpatients, wherever it is, there should be an open system for the nurses to come and report their error if it happens. So non-punitive reporting system is a must in a hospital situation. Then if an error happens, we should be able to analyze the cause of it. Root cause analysis is a very important thing. So regular analysis of errors to identify systemic issues will reduce errors, and it promotes a culture of safety. Then leadership support. Those who are in leadership position should support the employees, and commitment from leadership to prioritize patient safety is very important. Then engaging patients, involving patients in their own care, encouraging them to ask questions. This will help again for the patient safety. Patient is aware. A well-educated patient knows much more than any other person about their health. So this has to be implemented to improve a culture of safety. Then what are the roles of nurses and paramedics? The first one for nurses is enhanced communication and collaboration. So what we have to do is handle meetings, regular team huddles to discuss potential diagnostic issues and review recent cases of diagnostic errors. So we should have frequent meetings to find out what has happened and what are the issues developed, so that we will be able to prevent or reduce errors. Interdisciplinary rounds. This will help involving lab technicians in interdisciplinary rounds to ensure all team members are on the same page regarding patient diagnosis. Then education and training, continuous education, participating in continuing education programs focused on diagnostic process, common errors and new diagnostic tools. This will promote a culture of safety. Then simulation training, engaging in simulation training to practice scenarios involving diagnostic errors and learn how to prevent them. This is also very important. Then third one is patient involvement. We have talked already about engaging patient, encouraging questions from the patient, empowering patient to ask questions about their diagnosis and treatment plans to ensure they fully understand and can participate in their care. Then providing educational materials, providing patients with educational materials about diagnostic tests and potential errors so that they are empowered, they can think about their own health. Then reporting and learning systems. Error reporting. I have already said non-punitive reporting system should be there, and this will help error reporting from the part of employees. So actively participating in error reporting systems to document diagnostic errors and near misses without fear of retribution. Then root cause analysis, as I have told earlier, root cause analysis of diagnostic errors should be done and solutions should be developed. Then use of checklist, standardized protocols. This will help in preventing uh, overlooking diagnostic errors, preventing as well as overlooking diagnostic errors. To conclude, diagnostic errors significantly impact patient safety, quality of error, healthcare cost, and have legal and ethical implications. Addressing these errors require a multifaceted approach that includes clear communication, standardized protocols, and interdisciplinary collaboration. Nurses play a crucial role in this effort and are encouraged to actively participate in improving diagnostic accuracy by ensuring communication, following protocols, and engaging in continuous education. By doing so, they can help reduce the occurrence of diagnostic errors and enhance overall patient outcomes. Uh, I wanted to conclude like this. So, nurses being very important personalities in the healthcare system, they should be vigilant to prevent diagnostic errors or missed diagnosis through their vigilant observation, key reporting strategies, and following standardized protocols and checklists for preventing diagnostic errors. Thank you. I'm grateful once more, grateful to patient innovation and research, and also uh, my position as president NRSI. I feel gratified to associate with you, and I'm sorry to say that I won't be available on that day. That is why I'm recording and sending this uh, talk to you all. Thank you once again. Hope if you have any doubt,
Thank
this
you.
will be helpful to clarify it. And also, if you have any other doubts, you can mail me. I'll clarify it if you need. Thank you. Thank you once again.
Thank you. Thank you. Thank you. Arijit, I had a couple of questions. You shared with us a case study of a person who was not given treatment on time, and that has led to a change in the system. So, did your organization, as a patient organization, play any role in that policy change? And if so, what was the intervention that was given by you?
Yes, since we are patient network, you mean Heart to Heart Foundation or those patient
Yes.
organization? Heart to Heart
No,
Foundation.
to heart.
Heart to Heart Foundation, normally we work with those patient organization and work with those what we call community complaint center. because we are not registered as a community patient center, but mostly they come from consumer protection center before, because it already exists. But for this consumer protection center before, mainly they focus in the consumer problem, but later they include the health insurance issue. So, but by that time, by I'm working in National Health Security Office before, is my main work to support and establish all this consumer center, consumer protection center as a community complaint center, and it's expand very well. And every year we will have uh, they will have a training for strengthening our skill, our expertise, continuing. But every year we will have an annual forum. About 100 of them will come and exchange their experience and learn new things from each other. We have the National Health Security Office to input the new system for them, so they have more understanding. This is my role. But Heart to Heart Foundation, mainly we are not the community complaint center. Thank you.
No problem. Okay, thank you so much for that. Dr. Bhaskar, I had a question for you. Dr. Asuma Bibi referred to interdisciplinary rounds where lab technicians are also involved with the nurses to be able to understand the requirements of the patient. Is this common practice, or is it's done only in very big hospitals? Is it part of a common protocol? I have not seen any interdisciplinary rounds happening in most hospitals. So is this a recommended protocol, and how is this ensured in hospitals where it happens?
See, the important thing is that wherever patient care is there, and hospital or healthcare establishment is there, and the institution is there, each and every individual who are involved in the sample collection from the patients, may it be indoor, may it be outdoor, they should be aware what they are doing. If they are collecting, they should have a proper training, they should be evaluated properly, and they should be authorized to do that work. So the responsibility and accountability must be there. So it is an important thing that they are doing, and they should be monitored on regular basis, that they are updated of the work what they are doing. They should be aware of entire protocol what is functioning in the sample collection system. Each and every lab they produce one document like primary sample collection manual. In case of enable accredited lab, it is a mandatory to have this one for each of the position, whether it is a soft copy or in hard copy form. They should be aware of entire protocol. So it is an important activity from the nursing point of view, or the sisters point of view. Even the male sisters, they are also male, those who are in the attendance, they are also aware that they have to do it properly. What Madam has just Orijit has explained, how nicely she has explained that each and every activity, if it is dependent on the work efficiency, and it will reflect in the result and ultimately patient harm. And excellent examples she has already cited here. Thank you so much, Orijit.
Thank you. Thank you. Thank you, sir. The next question I have is that patient safety is not taught in medical school. I mean, we don't learn patient safety as a subject. It is sort of subsumed into everything else. Is it the same case for, say, lab technicians and nurses as well? And if that is the case, then do you think that we have to include something in their education at the basic level when they are getting their technician diploma or degree? Do you think that
not only patient safety,
should
the
be
sample
included as a
safety,
vertical?
patient safety means sample safety is an important thing. There are many times I have been lost, stolen, not found, like that. That means safety on the aspect of that is a safe thing. It is a patient's property. Patient has given some money to get the result. It does not mean that that material has been the property of the laboratory or the hospital. It is the property of the sample owner only. So it has to be safely every point till it is properly assessed in the equipment, they have got every right to go for legal actions on those. So it is very important to have the patient's sample safe and secured till the things are over. Yes, it is an important thing
Thank you
they should
so
include in the curriculum. Yes, yes.
thank you.
Can,
I
Thank you,
am
sir.
sorry that I
So,
was not very well with my my voice. I am
no,
sorry
no
for that.
problem. And
can I say
we are,
something, Ratna?
we,
Sorry.
Yeah,
yes, sure. We
yeah.
are, first of all, I must thank you that in spite of your ill health, you have joined us today. So thank you so much for that. And Orijit, yes, go ahead before I
Yeah,
wrap up the
just
session.
very short opinion that I like all those presentation and especially from Dr. BV since she's a nurse and it's already similar to Thailand case from the Nurse Association here. And what I think the capture word here or keywords here from learning from today is the communication, understanding, collaboration among those
Yes,
stakeholder. And it's good that if we can have a forum, all those stakeholders to sit down and share the experience and have some guidelines, mainly not in the concern with the system, especially, but it's a guideline for the mainly for the patient and the nurse and the technician to learn and to follow. And I just suggest that if Radna, you can set up some kind a forum, some kind like this that will be more benefit and more valuable because no one have done this kind of forum before. Thank you.
exactly,
Thank you.
exactly. Thank you so much, ma'am. Yeah,
I think Dr. Bhaskar and Dr. BV are all, very senior leaders in their respective forums. So if we can get them together and discuss this further on how we can have some guidelines for interdisciplinary teams, it will be fantastic. And I look forward to your guidance and support, sir, for this kind of an issue. So with that, I will try and conclude this current webinar. Thank you to all the speakers for giving their wonderful insights. I think this is just a beginning. We can do much more work together in a collaborative manner. And as Orijit suggested, if we can all get together and work on some of these guidelines and present them to various stakeholders, it will be a very good initiative. Everyone is coming with their own experience and research, as well as data on what kind of errors happen and how can teams work together to minimize those errors. So thank you all for joining us today. The recording of this webinar will be available on our YouTube channel. Thank you once again and have a great rest of the day. Thank you.
thank you, thank
Okay,
you, thank
thank
you so much.
you.
Thank you. Namaste. Swadika,
Thank
Bye
you.
Swadika. Bye,
bye.
bye, bye, bye.
Thank you.
Bye,
Thank you,
everyone.
ma'am. Thank you, ma'am. Thank
Thank
you.
you.
Thank
Thank you.
you.